we came up with a joint work plan that was shared across by partners and the government. We have a very strong county steering unit that coordinates all the partners, the development partners, research institutions, and other development partners like FAO, UNICEF, World Health Organizations, and we send, this is the information we have from Meteorological Department. What should we do? Start early coordination. We did our first sampling. And we wanted to ascertain before going into that if we have floods, definitely we will have RVF. It's a replica, it is happening. So what we did our first zero surveillance, and we found out that there were some very clean areas and very unclean areas. So we engaged Hillary. Hillary gave us a lot of vaccine for livestock. We had a series, we vaccinated, we need community sensitization, community talk shows, radio talk shows in preparation for RVF. And we also engaged the environmental department. We have another project called Anopela that's dealing with the Madenge, because we came to realize that areas with high population of Phrosophis juliflora, these are the areas that high incidences of RVF. Now that incidences here and there, and we did PCR and confirmed a positive case, what we are supposed to do as a unit, One Health, is now to intensify. Talk to livestock handlers. Please, we have come to tell you, don't slaughter animals. Go to hospitals, sensitize the community disease reporters and community health volunteers. Telling them to go to the community and mobilize, let them report cases, jaundice cases to the hospital immediately. And the environment people, they were there telling people, please move with your animal away from the flooding areas. Move from areas invaded by Juliflora Phrosophis. Make sure you are free from areas that have floods. And we intensified this campaign as a unit until, regardless of the floods that were invading the entire country, we didn't lose even an individual. When you have a joint work plan, accompanied by a joint plan, a joint budget, you have a heavy weight of negotiating with partners, regardless of their budget. They will be forced to reallocate, to reshift their budget, to support what has been prompted to them in a joint work planning, rather than when you are working in silos. As a Department of Veterinary Services, what we have learned our weakness is documentation. As long as we are saying we want support from partners, we want support from FAO, we want support from LRA, we are not being able to have a common reporting tool for One Health activities. Last 2 months, we were engaged in a meeting to try and come up with a monitoring mechanism. How do we need to report some of these activities under One Health? Because they are cross-cutting. But we want to find out how do we come up with a mechanism respectively for One Health unit activities, so that we build our evidence. And when we sat in a table with the people who want to support us to implement some of these, we are able to build our case, evidence-based building up cases, so that we can be able to resource. You can easily resource through evidence. You can't resource with a word of mouth.